News Talk 710 KURV, audio on demand.
Hidalgo County Commissioner for roughly the Edinburgh area, Josephe Palacios, and we're going to talk about a prospective healthcare district which might be on the ballot in November. Thanks, guys, for being with us. We appreciate it.
Thank you, Davis, you and Roxanne, for giving us this opportunity to respond to those comments made by Mayor Salinas last week about the role of the County Commissioners Court concerning the creation of the health district.
You guys, according to the legislation, and I got a copy of it from State Senator Chuy-Hinojsa's office, if the signatures of 50 valid voters are presented to you, you shall call an election. That has not happened yet, I don't think, right?
No, it has not. But let me tell you, we're not here. Let me tell you my position.
Sure.
Roxanne even sounded. I don't want to say confused because.
Well, that's why we have you on, Judge, so you can make things clear for us.
When you said we were going to hear the other side, and I said, whoa. But are getting confused. But let me tell you, I've known Mayor Salinas over 40 years. I've always had a lot of respect for him and his public service. So I was surprised last week when I heard him make really inaccurate and misleading comments about my role and the role of the County Commissioners Court concerning the creation of a health district in our county, because neither I nor any member of the court has declared any position one way or the other on the creation of the health district. If a petition were even to be filed, we are not telling anyone to vote for or against the district. Some people think that we have taken a position, but we have not. The confusion, I think, results because the law is, as you stated, Davis, the law was passed. First, you got to understand the County Commissioners Court is responsible for conducting all county-wide elections in this county. And the legislature passed a law that made it mandatory, no discretion, that if we are presented with a petition signed by 50 registered voters, they're wanting the referendum or the issue to be on the ballot, then we have no choice. We've got to follow the law. It was enacted by the legislature, signed by the governor. It's a law. We may not like it, but we got to follow all laws. We're a country of laws, not of individuals.
Judge, but I do have a question. When did this legislature happen? Because did it
2015.
The 50 needed signatures for the healthcare district to come on the ballot this November? When did it become law? Did it happen after it was voted down in 2014?
Yes. It happened in 2015. The legislature, the Senate, and the House of Representatives passed it, and it went to the governor, and he signed it, and it became law. Now, that requirement was the same one that was in place back initially when it was first created and voted on.
Mm-hmm. All right, so the legislation is in place which would come into play if there were enough signatures and people voted to create the district.
Right. I want to correct some of the comments that Mayor Salinas made.
Okay. He
is not correct when he says that state law requires us to spend 10% of our budget to pay for indigent health care. He told your listeners that all we need to do is come up with $26 million, and this will eliminate our need for a health care district. This is not accurate. First of all, our budget last year was $189 million. 10% would have been 19, not 26. But state law requires us, and it only requires us to pay for the health care of all qualified indigents up to a maximum amount of $30,000 per person, not even a total of 8, but not to exceed 8% of our budget. We are not required to pay 10% of our budget, as was stated.
All right,
Judge, if I may add to that, Judge, while we're on that subject matter.
Sure.
The commitment of the court since 2011 has been representing itself as best as it can when really addressing that not to exceed 8%. If you take from 2011, and this is public information, the court, even during the toughest economic times, had looked at taking advantage of the 1115 waiver. It's a federal program that's out there to add a 1.4% multiplier from federal funds to address indigent health care, uncompensated care. So in tune, the county has reduced their 8% maximum obligation in the last 5 years, saving Hidalgo County taxpayers $37.2 million in the last 5 years. The last 6 years. And I just wanted to make that note. The court has always been as resourceful as possible, assuring that we take advantage of all the federal programs that are out there that allow us to address indigent health care and uncompensated care. I just want to make that note while we're going over that.
Well, let me ask a question. If the budget was $189 million, and this is not a prodding question, it's because I'm not good with numbers. If it's $189 and you can spend no more than 8% of the budget, in essence, up to 8% or $30,000 a person for qualifying.
Why not?
What would 8% be of $189?
Well,
and what?
Remember, don't forget the key phrase, up to 8%. Yeah. And the reason is that I'm saying that is because once you look at all of the people that applied for indigent care, they're wanting us to help them because they can't afford it. They have to be processed. And the ones that qualified, we were able to take care of for only it was $9.1 million, which is substantially less than the 8%. So, and we were able to pay that off with $5.5 million because we took advantage of the 1115 waiver program that Commissioner Palacios made reference to.
When you spend a dollar for indigent health care, and then the government will essentially reward you or award you, if I understand this, 1.4 times that. Does that go towards satisfying the state legal requirement for spending?
That's correct.
Okay. So you don't have to tax the taxpayers to get to that no more than 8%. You can achieve that with federal pass-down money. Okay.
Right, and we only tax the taxpayer up to $5.5 million and meet our obligation in that manner. So Mayor Salinas was totally wrong when he was contending that all we needed to do was come up with $26 million. Why would anybody want to spend more than we are required to? We're saving our county taxpayers by those numbers over $20 million a year.
So, Judge, if this were to happen, if this healthcare district were to pass, what would happen with that money that is being used now for indigent care? Where would it go? Indigent
health care would be taken over by the healthcare district if it were to pass. So we would not have a need to spend that money. That $5.5 million.
The obligation is shifted from the county of Hidalgo to the then created healthcare district, if that's what comes to pass.
That is correct.
Okay. Do you guys know we're gonna have to stop here? I'm talking to my producer. Okay, we can keep on going. How is this going to work? Do they call one of you guys and say, "Well, hey, we're bringing the petition into Commissioner's Court," or do they? Do you know of anybody out there doing this? They don't have a whole lot of time to get this organized, although 50 signatures is not that tough, I wouldn't think.
That's not. I mean, if anybody 50 signatures is not that tough a requirement. No.
Well, do you know of anybody out there gathering signatures or about to gather signatures?
Not that I know of anybody specifically, but I understand, and I've been, overheard and have been told and been made aware that there was a strong possibility that they were going to file a petition. Mm-hmm. That's what we were trying to get ready when we were trying to hire an auditor consultant.
Yeah.
Consultant, yeah.
A consultant, sorry. Judge,
because, yes.
I do want to ask, there was something that Mayor Salinas said that I've been hearing two different things. I've been hearing that if it starts at 8 cents, right? It starts at 8 cents, the cap is 25 cents. Two things. The ballot language says that it will not show the cap. And I don't know who's in charge of that, who I can ask as to why not. It says here, change the ballot language to include the initial tax rate, not to include the tax cap. So it'll start just at 8 cents. And it won't go to 25. That's what I'm thinking on the ballot.
I'm confused.
That confuses me.
I don't think that's correct.
Okay, which is why I'm asking. But another thing I wanted to know is If it passes and it starts at 8 cents and the cap is 25 cents, who is in charge of the increase between 8 and 25? Because I was told that even if it goes to 10 cents, 11 cents, 9 cents, that the board, the healthcare district board, is going to be in charge of increasing it. Then I was told somewhere else that it has to go by, okay, so it's the board who increases it.
If the board increases it, and then if it goes beyond the rollback provision, you remember, are you familiar with the term rollback?
Mm-hmm.
Yes.
The rollback provision would allow, if they went over, let's say, over a penny, over half a penny, then it would be, in order for them to maintain that increase in the tax rate, the community would get involved and request a rollback election if they so desire, and they'll be given one. But and even then, if it passes, then it'll be up to the county commissioners court to veto or approve any budget that is presented to it.
So the commissioners court would have final say over the budget they come up with.
Over that budget, that's correct. That's a safeguard. But an additional safeguard is that rollback provision.
I have so many questions for y'all guys, really.
Well,
we're here.
There was one thing that I was thinking. Oh, we want to go to break? Okay, let's go to break first, Judge.
We got to pause for a second, guys. So if you'll still stand by, County Commissioner Josephe Palacios, County Judge Ramon Garcia talking about a proposed, still to be proposed, Hidalgo County Healthcare District. This was a hospital district in 2014 when the taxpayer said no. And I guess it's believed that it's going to come back up again. Petition given to the Commissioner's Court. They got enough valid signatures that are required by law to call for the election. 526 on 710 KURV. Davis Rankin, Roxanne Garcia. Last week, Mission Mayor Norberto Salinas in studio made known once again his opposition to a healthcare district. He opposed the hospital district vote in 2014. The legislation was redrafted, changed, and it passed 2015 legislature, and it's a Hidalgo County Healthcare District. However, it's not on the ballot, so don't go thinking it is. It will be on the ballot only if 50 valid voters present a petition to the Commissioner's Court, then they're required to call one. The ballot language still has to be come up with. Someone will have to write that ballot language. The sticking point was, one of the sticking points was that in 2014, if we had passed the district, that there was a 75 cent per 100 cap, because that was the state law at the time they adapted to us, and people didn't think that was a good deal, and they went back, made it a 25 cent per cap. But you're also supposed to, whatever their tax rate is, Hidalgo County is supposed to lower theirs, is what I read in the legislation. That makes sense?
Yes. What we would do is we would do away with about what comes out to about 2.5 or almost 3 pennies. It doesn't, in order to be able to generate the amount of money that we would not be spending on indigent care, which would be the $5.5 million, plus the cost of administering the program, which is about another $1.1 million or something like that, David. Whatever the savings the county would have, it would be passed on, and we would be reducing. We are required to reduce the tax rate by that amount.
Judge, what is the main reason for this healthcare district?
Well, we have a tremendous amount of poverty in our community, and the healthcare may not be what it is in other parts of the state, and the healthcare community has gotten involved in trying to push this, contending that this is going to be a way that would improve the health care for many in our community that cannot otherwise afford it.
Mr. Palacios.
If I may add to that. Yeah, if I may add to that, I know we're so fixated right now, and I think most of the taxpayers are fixated on a healthcare district and additional tax. I'm not a fan of a new tax for something that the taxpayers already paying for. But I do agree that public health is everybody's business at this point in time, at any point of time. And I do believe in the concept of we are our brother's keeper, and we got to take care of our indigent population, our population that's in poverty. We have 33.5% of our population. It lives in poverty. And we definitely need to find solutions to the bigger problem is public health. We're a growing community. We're going to continue to grow. And as I was going through the numbers, if you look at indigent population, numbers continue to grow.
Yeah.
Uncompensated care numbers continue to grow. We have to find that balance. Now, is the hospital district an answer to that? I'm not a Palacios in that. I'm not an advocate by any means, but I am in the position to assure that at the end of the day, whatever we advocate is in the best interest of the taxpayer.
I don't know.
Not the hospital systems. And I know there's been a lot of critics out there, and a lot is lost in the rhetoric of, do our elected officials think first of the big corporate business versus the taxpayer? And I profoundly say inaccurate. I personally think of the taxpayer. I've seen the judge in many occasions look at the taxpayer first, and we have to start there.
I don't know if any of y'all will answer this, Mr. Palacios. Before we get to break, though, I want to know if y'all know the answer. Do indigent people get a bill when they go to the hospital? Or is it completely paid for by taxpayers?
Well, and that's a good question. Going through the program, the county health care does manage the indigent health care program. And there are actual expenditures that we track when it relates to indigent health care. And there is the uncompensated care of obviously the hospital. The hospitals are more in tune with what their losses are on the uncompensated care part. Basically, we're trying to figure out, and we have to partner with private and public. These are your public-private partnerships to try to figure out how to find the best answers for our local problem in the areas of public health. And we're very fortunate the federal government has the 1115 waiver. Now, do note that it is set to expire by 2017 under its current state. We are going through a renewal, which will restart another 5-year program where we'll have the multiplier and take advantage of the federal funds.
You're talking about this.
But the benefit has been to the local taxpayer for the last 5 years, at least the last 5 years, and where we've been able to reduce our obligation by $37 million. It still doesn't change the mere fact that there still is a dire need to address the growing problems of the indigent healthcare population, the increased number of our population living in poverty.
Mr. Palacios and Garcia, if you all would hang tight or be cool, we've got to pause for news here at the bottom of the hour.
We'll all take a breather, and then we'll come back.
We're talking with County Commissioner Josephe Palacios, County Judge, Hidalgo County Judge Ramon Garcia, talking about the healthcare district that may come up for a vote in probably November here in Hidalgo County, and you're listening to 710 KURV The Drive. 540 on 710 KURV, Davis Rankin, Roxanne Garcia. We're talking this hour with Hidalgo County Judge Ramon Garcia and with Hidalgo County Commissioner Josephe Palacios. Last week, Beto Salinas, the mayor of Mission, who in 2014 campaigned against the then hospital district vote, was signaling last week that he's opposed to if it comes back up again, he's opposed to it. He says Mission can't afford it, and it's just going to be unending tax. That's kind of a shorthand way of what he was saying. And he also was talking about the Hidalgo County Commissioners Court and why didn't they sort of keep control of this as opposed to allowing a healthcare district to be passed. Guys, one of the things that Roxanne and I were talking about, We've read the analyses that Senator Hinojosa's office furnished us. We've looked at the bill that was passed. The bill is easy to read. But a lot of our questions, I mean, you guys really aren't the guys to ask unless you're going to be out promoting this whole thing, which it's not even before you yet. You guys are going to get stuck with a lot of the questions that still can't be answered, right?
That is correct. I did want to answer that last question that Roxanne had. The indigents are billed for all practical purposes. They don't pay. I mean, we step in and we put we pay for whatever their bill is. Last year, we provided indigent health care benefits to 5,400 individuals that qualified here in the county. The average bill per individual was $1,700. The maximum bill that we paid, the maximum amount on the bill that we paid was $30,000 per individual. That's a maximum, but the average was $1,700.
Do you anticipate, you and Mr. Palacios or any of the other commissioners, do you anticipate if this comes to you, and I guess everybody thinks it's going to come, that you all as either individuals or as a body will be for the idea and campaign for it?
Well, I think if it does come about, we're going to have to hear from the healthcare community, and that's why we were going to be trying to get an expert consultant on board so that he or she could come in and explain the pros and the cons, the benefits, conduct an analysis as to what we are getting as a county and what the taxpayer is getting besides the higher tax bill, and then inform the community, and then let our democracy do what it needs to do.
And if I could add,
go ahead.
I don't see it. I don't think we have a choice but to get somewhat involved to assure at the end of the day that the taxpayer at the end of the day is, and the need as well, is at the heart of the issue. Under the current legislation, I know it was drafted. I think they had a revision to the cap. I can't say that I'm for the current format at all. I think at the end of the day, the idea should be a zero effect. I think the county, if it does get the signatures, we're going to have to get in front of it to assure at the end of the day there'll be a little to no effect to the taxpayer, and work in partnerships to figure out how there's going to be an increase to access to care, or at the end of the day, there's a benefit at the end of the day to a larger population than just the indigent healthcare.
How is it? How is it though, Mr. Palacios? Because say me, for example, if this passes and we're paying extra money for this to happen, if something were to happen to me and I show up at the hospital, but I don't have health insurance, but I'm not an indigent, I won't get treated.
Well, you're talking about the hospital just alone. Mm-hmm. Preventative care. If you're looking at the 1115 the DSRAP program, under that federal program, we do have 77 different other projects or programs throughout the county, of which 39 are here in Hidalgo County, of which there are several services in the medical area that could be of benefit to our population. I know last year, just alone, we've received more than $300 million worth of care into this area, and it wasn't just to our indigent population. So there has to be a median. It can't just be, we're talking about healthcare in general. The idea is, how do we prevent preventative care to avoid the hospitals? And we have to do a better job in public health to address that issue, so that we don't look at these large numbers of uncompensated care or cost to our indigent healthcare program.
Now I got a question for you guys at 544. That is, when this initially came up, it was said that we needed to set up a hospital district, healthcare district, in order to get the University of Texas system to put a hospital down, a medical school down here. And I was told somewhere else, I don't remember who, that they never go in to an area unless there's a hospital district and a charity hospital. They don't want to partner up with for-profit hospitals. Obviously, that's not the case. Yeah. But Mr. Salinas says, I'm opposed to the hospital district, but we will pay money to fund the medical school. But here's the question. I think Hidalgo County promised money to the medical school. McAllen, Mission, Edinburgh did. Who's paid money? They don't need that money to operate any longer, although that's in the legislation. Yes.
No, that's not correct. They don't need that money. I mean, unfortunately, the legislature does not fully fund the operation of the medical school. They're relying on the money that we committed. It's going to be over a 10-year period of time. It's about $5 million a year over a 10-year period of time, to be paid by the city, by the county, $1 million, McAllen $2 million, Edinburgh $1 million, FAR $500,000, and the city of Mission had initially committed to $250,000, and then later sent us a letter saying that they were not going to be honoring that commitment for whatever reason.
Judge, why not have? I was talking to somebody earlier, and he was telling me that a lot of medical schools, they raise all this money by donations. Instead of making the taxpayers pay for it, they have hospitals or they have people that raise money to help pay for this. What about that idea?
Well, we don't have too many individuals that
have the wherewithal.
Maybe living.
Yeah. Another question I wanted to ask.
We need more rich people. Is that what you're saying, Ramon?
And we are trying to figure out a nice way of
just
putting
say
it out there.
Now, this is something I also wanted to ask about the appointment of the board of directors. If they have the right to increase the tax, if this passes from 8 to 25 cents without any of us knowing, not going to vote, why not have the people vote those board of directors instead of them being appointed?
Well, I mean, the people are going to know that they're going to have an opportunity through the rollback provisions to challenge it. And the county commissioners court, which is an elected body, will be overseeing that particular budget. And we're not going to let that happen. I can't speak for future courts, but at least I know the one that's in place now is not going to allow that to happen. So I'm not sure what other safeguard you can impose.
I got another question, which it seems to me you would have a role in this. There's language in the legislation that says the new governing body could set up effectively an ambulance service or an EMS service, and they can also erect facilities, including hospitals. There's language about hospitals. Now, I don't know that was what was are they planning to go into the hospital and ambulance business? What would the commissioner's court position be on that?
The present county commissioner's court, my feeling, my perception, my understanding is that none of us want to get involved in building a new hospital or in the healthcare industry. I mean, we're going to be meeting our obligations, which are going to be taken over by the healthcare district if it's created. And then we're going to be reducing the amount that we collect from our taxpayers to presently fund the indigent healthcare program. And then we're going to go on about our business and road and bridges and drainage and other things.
Judge, I have somebody on Facebook wanted me to ask this question. It's just how many more times, I know you people are upset, how many more times do we have to vote no on this proposition or ballot to get through to the professional politicians is what I was asked.
I feel the same way he or she does. But unfortunately, the legislature did not put a cap on the amount of time. This is not something that's being generated by your county commissioner's court. This is something that came from the legislature that was signed by the governor. If there's any complaints to be made, they ought to be made to the people that voted for it in the legislature and the state representatives, the state senate, and our governor.
Do you have any idea? It's 5:49, so we're almost out of time. Do you guys have any idea, ballpark estimate of what their initial budget would be? I mean, it's obviously whatever the county is spending now, but they're going to draw down that federal matching money, and then there'll be more of it, they say, plus the tax, whatever the tax generates. That's an enormous pile of money. Arguably, it's going to be a bigger budget than you guys.
Well, yes, obviously it is. Because, I mean, the 8 cents are going to be generating approximately $24 million based on our current property appraisal. But if you will read the law that was sent to you that you earlier told us about, the funds shall be used for, number one, improving healthcare services for residents, supporting the School of Medicine, and helping train physicians, nurses, and other healthcare professionals, and then obtaining federal or state funds for healthcare services and providing community health clinics and primary care services. So they're envisioning improving the access to healthcare for more individuals and better trained individuals. But you're correct; it'll be an enormous amount of money. If the 24 comes in and they're able to multiply it, that's going to be an important board that's going to be created, and it's going to be monitoring administering all these funds.
Roxanne has one last question.
Again, Judge,
Quick.
this is somebody on Facebook. He said that last year at the July Hidalgo County Democrat precinct meeting that he said, I'm guessing it was you, that we will bring this district up to vote again and again until it passes.
And somebody said that I had said that. I mean, it's unfortunate that they did not understand my position, which is the same one I'm telling you now. The legislation, the law that we took an oath to follow and that we are going to follow because it was duly enacted, does not set a time limit, does not say it can only be considered one time, two times, three times, four. It doesn't have a limit. It's kind of like a school bond election. There's no limit. They just keep on coming.
So your comment as reported was not your preference. It was a statement of what you think is going to be happening.
That's correct.
Yeah, there's.
I understand the meaning of the word "no" very clearly.
So, we have no more time, I'm afraid.
But so many more questions, you guys.
But we'll become good friends or good acquaintances anyway by the time this is all over. So,
Roxanne, send me a list. Email me a list of those questions, and we'll be very happy to answer them and send them back to you so you can advise your listeners.
Thank you, Judge.
We will do that. Judge Ramon Garcia and County Commissioner Joseph Palacios, thank you very
Mr.
much
Palacios
for your time.
and
We
Mr.
really
Garcia.
appreciate it.
Thank you.
Thank you, guys.
Yes, sir. You're listening to The Drive Home on 710 KURV.